Are you feeling fatigued, low energy, weak while you're lifting weights in the gym? Vitamin D might be an issue. I'm Dr. Nelson, your physical therapist, and today I would like to talk about vitamin D deficiency. Essentially, vitamin D is a nutrient that your body takes in that helps you absorb calcium and phosphorus, and it's necessary because these things help with your muscle function, also with the strengthening of your bone, also with your overall mood. All right, so the first thing you want to do is go to a doctor and get your labs if you have not already. During your yearly checkup, they should test your vitamin D level and make sure it's at the adequate level. If it's not, there's a few things that we must do. However, before we go on to that, we need to know who are affected or put their risk of having vitamin D deficiency. First of all, after a long and grueling winter that we went through, we're inside and there's less sun outside. So that can affect you and decrease your vitamin D levels. Second of all, if you have a lot of melanin like myself, it becomes harder to absorb the sun. All right. Hence, individual with darker skin tone might be at risk for vitamin D deficiency. Older adults that stay in the house a lot and sedentary individuals are also at risk for vitamin D deficiency because they're inside so much. All right. So those are things that affect you if you don't know already. Also, if you wear a lot of clothing and you cover your skin, you won't be absorbing that vitamin D as well. All right. So how can we address this? First of all, you need to eat foods that are rich in vitamin D, such as egg yolks, certain vegetables, cereals, fortified milk. These are essential, but that's not enough. All right. If that's not enough, you have to take supplements. Supplements are essential to kind of bridge the gap if you have low vitamin D deficiency. But we have to be aware of the dosing of these said supplements or vitamin D because you can affect your body, right? Too much is never good. You can have kidney issues if you take too much of this vitamin D. So you have to know how to supplement yourself. All right. How many milligrams should I take? So now when you address this, it might change how you go into the gym. It might change your low mood. It might change your risk of falling and breaking a hip or fracturing yourself because you're fortifying your bone. So the next time you go to the doctor or you feel like you're low in mood or you feel weak, it might be a vitamin D deficiency. I recently went and I noticed that I was vitamin D deficient. So now I have to integrate supplements within my diet so I can address this and it help me all the way in the gym. In the morning when I wake up, I'm not as fatigued. So if you have any of these symptoms and you notice that you have pain and you go into the doctor and you're vitamin D deficient, these are things that you need to do to address this.